Hello, my name is Dr Sriram Narayanan. I'm a vascular surgeon with the Harley Street Heart and Vascular Center at Gleneagles Hospital. Vascular surgery is the surgery of arteries and veins, which are the blood vessels that carry blood around the body. So really we are surgeons for the circulation. And today I'm going to speak to you about pelvic congestion syndrome, which many people would think is a gynecological condition, but we now understand is actually a vascular surgical condition. Well, the treatment options are dependent on what stage of life the patient is. Have they had children, completed their family, or are they still not married, still not had children? If they've not had any children, or they're planning to have more children, then any vascular surgery intervention in them is a no-no for me for pelvic congestion. And the reason for that is whatever we do, when they do go on to have children, the blood flow in the pelvis will change when they are pregnant. And then the results of these surgeries can be very unpredictable, and we don't have enough information on what happens afterwards, so we don't intervene. On the other hand, if they finish their pregnancies, and they're usually in the age group 35 to 45, they are the ones in whom we would offer surgery or intervention more easily. When I say surgery, it's all minimally invasive now. Then in the age group after 45, 48, when they're coming close to menopause, the kind of intervention will be dependent on the symptoms they have. If bleeding is a predominant issue, then it would be nice to hold on because it is going to stop. On the other hand, if pain is the predominant issue, then that is not going to go away even after menopause, so they might need an intervention before that. So that is the first determinant. The second determinant is, where is the problem? The problem can be because, like I said, there's compression of the vein in the pelvis. You can also have compression of the ovarian vein, or the vein draining the ovary as it enters into the kidney veins and back. If the problem is in the kidney veins, then the treatment is to block those veins from transmitting pressure into the pelvis. So what we do is we put in some coils in that vein. These are like stents, but they're coils, and they will stop that vein from pushing the pressure back. On the other hand, if the pressure, which is more common, is in the pelvis itself, then to stop the artery from squashing this vein, we put a stent inside the vein, which is really a rigid tube that converts this collapsing tube into a rigid tube so that the artery on top can no longer press on it. So both these are options. Occasionally you may have to do both, but that's extremely rare. Usually women who are heavier built tend to have more compression in the pelvis, and women who are extremely thin tend to have the problem in the ovarian vein. It's unlikely to be both, so it doesn't usually happen. When we do this procedure, it is important not just to do it blind. You need to do it under something called intravascular ultrasound, which is again ultrasound, except that in this case it's a very fine ultrasound tube, which is about the thickness of a ballpoint pen refill, that we pass inside the vein itself. So it is done during the procedure, so that we can make measurements, assess sizes, what size of stent you need, where the stent should go, what kind of coils to use, what size of coils to use. So all these assessments are done on the operating table using an intravascular ultrasound itself. In today's day and age, the treatment for pelvic congestion should be structured like this. What stage of life are they in? Can you try and control the symptoms with medication, or if bleeding is a symptom, with Mirena coils, with progesterone implants, with hormone therapy, which your gynecologist will help us with. But if the symptoms are severe, the family has been completed, then we would look at intervention either with coils or stents, depending on what the problem is. If they're closer to menopause, then we would try and avoid again, because in the end a coil or a stent is a foreign body being left behind in you, and it's best to avoid it. But if it is not looking like it is settling down and pain is a predominant symptom, then we will intervene in the perimenopausal age as well. If you have any queries about pelvic congestion syndrome, or as the new term for it is pelvic venous hypertension, which is the new term that has been recommended, please contact us or contact your family physician or your gynecologist, and don't ignore these symptoms as something that you just need to live with.